Okay, I think we are live. So this is our first live Q&A. We're excited to do this. If it goes well, we will do more of these, maybe on a monthly basis. We've got a lot of questions that are already starting to. Go ahead. For the first one.
First issue, do we believe that N plans will be more stable than G plans because of many people guaranteed to G plans right now? And so, number one, as I share my comments with you, I think it's important for you to know that if someone gets an N plan, I do not think that is a bad decision at all. An N plan is fine for sure. But what I do have issue with are those that are really dogmatic that the N's are going to be much more stable than the G plans, because the story is everyone that's unhealthy is going into G plans, and that is not true. And what I want our folks to know as you watch this today, when people get a Medicare supplemental plan, the majority of them that are getting that, I'm talking probably 95, 97% of all people getting MedSup plans today are in what is called the Medigap open enrollment period. And they're either turning 65 and they're going on Medicare, or they work beyond 65 and they're coming in using what's called the special enrollment period. And whether I come in at 65 or I come in at retirement, I have this period of time called Medigap open enrollment period, which is a 6-month window where I can pick any plan I want. I can do a G plan, an N plan, a K plan, L plan, whatever plan you want. And there's no underwriting. So there are plenty of unhealthy people that are going on N's as well as G's in these other plans. So I would say truly less than 5% of all people are coming into Medigap plans apart from their Medigap open enrollment period.
Yeah.
Okay. So the whole point is, go ahead.
Yeah. So people talk about this idea of like guarantee issue, and they think that means like no health questions, and it does mean that. But what technically Medicare supplement plans guaranteed issue is like a very, very probably less than. So we'll do like we'll probably help maybe 1,500 people this month get on Medicare supplement plan. Of that, we'll have like 3 to 5 people who actually qualify for this guaranteed issue thing. And so we don't need to belabor the point, but if everyone's out here saying, hey, your rates are going to go up because G's are guaranteed issue and N's aren't, it's just like saying like, it's just not true.
It's not true. And besides that, I want to add there's really more to rate stability than that anyways, because rate stability has much to do with how large is that group, what kind of a market share. We had someone just recently, interesting, I think it was in the state of Ohio or someplace, can't recall, but we were looking at a couple plans, and one carrier had 218 policyholders in that area. Another carrier had literally 33,000. Okay. And so what contributes to stability? It's the market share of that company. It's not the N plan, the G plan. It is how many people are in that group, because that means that the risk is spread out to more policyholders.
Yep.
That's really what matters. So again, if you want an N plan, that's fine. But I'm just saying this whole idea that for sure it's going to be more stable. I just don't buy into that for that reason.
Okay. Let's do a question here. Joni Jones says, if I am on an Advantage plan, can I change to a supplemental plan? And the answer to that is probably yes, as long as you can medically qualify, right? So if you've been on an Advantage plan for, 2, 3, 4 years, you loved it, you save the premium, something changes in your health. At that point, if you want to get a supplemental plan, to get more coverage, lower out of pocket, that's what you're going to have to medically qualify.
Yeah, and that's true. Joni, I want to share this with you though. Unless you're in New York, Connecticut, Maine, or Massachusetts, those 4 states only. All the other 46 states, you have to medically qualify to get off that plan. So once you've been on that plan, again, like Josh said, year 2, 3, or 4, whatever, you're going to have to medically qualify. And not only that, you can't just do it any time. You have to do it during the Medigap open enrollment season, October 15th, December 7th, or January 1. So we are restricted there. And so just keep in mind, I've seen a lot of people, Advantage plan for a few years, and then they get sick, and now they want to switch, and their health has changed. And Joni, it doesn't have to be something life or death. It could be something as simple as you had an AFib incident, And because that AFib incident is now in your medical records, you will not be able to get off your Advantage plan for the rest of your life. Rheumatoid arthritis, insulin-dependent diabetics, all those kind of people, and your health can change very quickly. So it's very hard to prepare. I'm going to stay on this Advantage plan for a certain time, then get off. Well, your health can change, and that may never be possible.
Okay, next one from Rim 2809. If I am 64 and have Medicare due to a disability, what do I need to do at age 65 if I'm happy with current Medicare choices? Medicare with a Medigap Plan G and Part D drug plan. So the answer to that is, like, if you're already on Medicare due to disability, it's a very important time period for you because you are going to be treated just like everybody else who's just taking into Medicare for the first time, which means you are eligible generally in most states for a host of other new plans, and there's no medical underwriting or medical qualification. So some people just hit that 65, they think they're good and sail through. That is not the best thing. The best thing is always do a complete review of your coverage to see, hey, is there something new that I didn't qualify for previously, or is there a way to drop my rate? Because you can save, if you're on a supplement plan already, you can basically come in into a new carrier, be treated as 65, and get that supplemental plan rate lowered.
Yeah, I just want to add to that. Josh is right. So it could be more for some premiums with somebody that was coming in because of disability, and I mean substantially more. So what you want to do, this is officially called your IEP2, and you want to be sure to reshop that because that carrier has to give you the T65 rate, which could be lower. So make sure that you compare that. So I would definitely do something about it. Just get another G plan. It's fine, but we're going to a new group.
Okay, Rick Wright, is there a pre-existing qualification if you want to go from N to G?
And the answer to that would be yes, other than in those 4 states, because anytime we're on it and want to get up to G, if you're beyond your 6-month Medigap open enrollment period, that means 6 months of your original B date. Anytime we're going to move off that plan, you have to medically qualify to make that move.
Okay, we're going to slow down for just a second. So we've been going for a few minutes answering some questions. My name is Josh Musick. This is my dad, Marvin Musick. We started this company, MedicareSchool.com. We started this 14 years ago. And now our company helps about 1,500 people a month. We've got a team of 80 people sitting outside of the studio that every day we're helping people get on Medicare, choose the right coverage, compare all the options, no hassle mistakes at all. So if we can ever help you, you can call our 800 number, which we can put in the chat, 800-864-8890. Schedule an appointment with one of our people, and we'd be able to help you. Okay, next question. This one's good. Full-time W-2 employee with medical benefits signed up for Social Security benefits in 2022 and automatically was signed up for Part A. I was told that since I had Part A for 2023, I cannot contribute to employer's HSA.
And that is correct. Yeah, once your A date has begun, you can no longer contribute to that HSA. Now, the money is still yours in there, obviously, but once you have Medicare, A or B or both, no new money goes in. So whoever chose that's true. Now, let me just add this to those of you that are contributing to an HSA and you are going to continue to work and you want to contribute to that HSA. Let's say you're going to work 2 more years. Here's the keep contributing to your HSA until the A date begins. So if I
Medicare Part A date.
Yeah, Medicare A date. That's right. So let's say we're going to start our Medicare A and B at age 67. And once you do that enrollment into Medicare, what they're going to do is they're going to backdate your A date 6 months. So technically, you want to be sure to stop contributing to your HSA 6 months prior to enrolling into Medicare. Okay, now they'll never backdate your A date prior to 65 at all, but they will backdate it once you start Medicare at a later date. So you can no longer contribute. I want to keep this in mind as well. Some people will put money in, and as long as let's say you're going to keep contributing, they will prorate the annual amount. Right now, that amount's $4,850, and so basically $400 a month. So as long as you have not put any more than that prorated amount, you will not be penalized.
Okay, this is a good one. E. Smith, if I sign up for Plan G Medicare coverage and become employed after I start Plan G, can I join the group plan and pause my Plan G? assuming your company has more than 20 employees.
Yeah, here's the way I would handle that, Mr. Smith, or whoever, Ms. Smith. What I would do, as long as it's 20 employees or more, I would actually suspend my B. You can terminate Medicare Part B in that G plan. And the way you do that, there's a form called 1763. You fill that form out. And again, you got to stay enrolled in A, because once you've enrolled in A, you can't get off of that. But you can terminate B. Fill out the 1763. You'll send that to your local Social Security office and terminate that, and then also terminate your G plan. And then, when you decide to retire again, then what you'll do is you'll come into Medicare and you pick up B again using what's called the special enrollment period. As long as you have credible coverage, insurance at work, and active employment, you or your spouse, you can do exactly what I said. Suspend B, suspend the Medigap policy, and then pick it up later, and there will still be no underwriting required whatsoever, still be in that Medigap open enrollment period.
Okay, we're getting some reports that people say the audio is not working, so we're going to try something else here. Let's see. Should be fixed? Okay. Okay. Can you guys put in the comments here if the audio has been fixed? Audio much better? Okay, good. We're good. Okay, let's get back.
I'm going to answer that, or we keep on? Was that good enough on that one?
Yeah, that's probably fine.
Okay.
Okay, if you still work, you're 66 years old, is it worth it to get on a supplemental plan and give up private company insurance, Cigna? The answer to that is maybe, right? So generally what we look for is we know that you can get on Medicare Part B for $165. You can get a supplement plan, let's maybe say $125. So now you're at, what is that, $280?
Yeah.
And then get a drug plan for maybe $15, $20, so about $300. And what that's going to give you is really, really good coverage, right? So you're going to have the A and B is going to pick up first. The supplement plan is going to basically pick up the rest. If you get a plan G, you'll have a $226 deductible. So compare that $250, $300 number if you were to go on Medicare to what you have on your employer coverage, and then make that decision. Because we talk to a lot of people, and it's about a 50-50 shot, where somebody comes in and they've got, hey, I'm paying $250 a month for my employer coverage, and it's got a $2,000 deductible. Well, we know for $300 a month, we can get you down to a $226 deductible with 100% coverage out after that. No co-insurance or deductibles or anything like that.
Can I just add one thing to that?
Yes.
I think what I would do, if that's your situation, is look at your medications. Now, once we get into 2025, this would not be an issue, but we still have the coverage gap, the donut hole in 2024. So be sure to look at your medication costs, not just the cost of the plan. But I agree with Josh. I would say if you're paying $250, $300 or more for that group plan, Medicare is probably going to make more sense for you. So that's number one. Look at your meds. Number two, the timing of this, because all employers have to let you go on Medicare when you turn 65. But after that, not all employers will, except during the employer open enrollment season. So you may be restricted on your timeline. So be sure to check that one out with your HR department.
Okay. Actually, I'm going to go back here. Evangeline, you said your supplement will be about $450. I've never. I guess maybe it depends a little bit on your age.
Can you tell us where you live? Well, she says she's 66. So
yeah,
where are you
$450. That's. That is.
Yeah.
That's way. Out
Maybe
of
you're
line.
looking at everything.
Yeah.
Do we know where she lives? That'd be awfully high. The average G plan right now across the country is going to be in that 125 range. So, Evangeline, I don't know what your
she lives in New York. Okay. If you're in New York, you just get an in. Compare in, right? That's going to be way look at the in plan. There's in the state of New York, you can get G's, but they're just way overpriced. Okay, let's keep going here. This is an interesting question. I still work. Company doesn't offer insurance, so they say they will pay me each month half the premium. However, paperwork is a bear. If you're struggling with paperwork, call us. We'll help you walk through all this. It's easy, easy. We do it constantly every day. Okay. And if your company will pay you for half of that amount, that's a bargain, right? So I don't know why you wouldn't do that. Yeah. Give us a call. We'll walk you through. We do that every day.
Yeah, that's.
Okay, Gail. Gail, you said Medicare bills you based on your salary 2 years ago. What do you do if you are now retired and do not have that high of an income anymore? So that's an easy one. Google the form SSA 44 or call our office SSA 44, and you can appeal that. You do have to have a life-changing event, which retirement is a life-changing event. So you can do that, and they will drop you as long as you're down below that threshold. Then that IRMA bill will be dropped off. And a lot of people have confusion about this. They think if they get hit with an IRMA for 1 year, they're going to have to pay that for the rest of their life. That's not true. It resets every January. But yeah, SSA 44 will be your friend.
Yeah, I just want to add to that. When you say your salary, that's called actually modified adjusted gross income. And so the way you can determine that, look at line 11 and line 2A on your 1040 form, and that will let you know what numbers they're going to look at. And then keep in mind there are 8 life-changing events, and it sounds like you're going to have that. You're going to either retire or semi-retire, and so you do have the right to appeal. And that's what Josh is talking about with that form. So I've never seen someone appeal and not win it. So you'll be able to do that. And so you can use that life-changing event 2 years. So it's a great opportunity.
Yeah. Okay, Robin Rumsey, I live in Texas and would like to know if I can switch from a supplement plan G to a plan N with the same insurer without going through medical underwriting.
Okay, yeah, I am pretty sure we run a lot of business. In fact, Texas, I think, is our second largest state where we write business. But I am pretty sure that the only way you can move from a G to an N in the state of Texas would be to actually medically qualify. There are some states where you could make that move, but Texas is not one of them. Now, keep this in mind. Sometimes a carrier will allow that. No carrier can go above and beyond the federal rules, but they can have some of their own as long as it's more consumer friendly. So what I would do, Robin, is I would call your carrier and find out if you can make that switch from G to an N without underwriting. And they may allow you to do that. And so that'd be fine. If not, then I know Texas, as a general rule, would not make the insurance companies follow that.
Okay, Jill O, this is a great question. Do all Medigap plans have the same coverage? If so, what is the best advice for selecting one Medigap plan over another Medigap plan since they all cover the same?
Okay, all right. So when you say, Jill, do all Medigap plans have the same coverage? The answer is no. We actually have 10 different plan options. For most people today, it would only be 8 if we're born after January 1st, 55. And so we have a lot of options, and each of those options are given a letter, A, B, C, D, F, G, K, L, M, and N. So we have these options. And so my advice for you, number one, if you're a person that really doesn't want any surprises, meaning you just want to know for sure what to expect, I still think the G plan. By the way, I'm 62, I'll be 65 here in a couple years. I would go with the G plan. We said earlier, I don't think an N plan is a bad option, so look at the G or the N. But the G plan, what I like about it is there's going to be no surprises because the only thing you're responsible for is the Medicare B deductible. This year, that's $226. Last year was $233. And so I know for sure what I'm going to be out of pocket. If you go with that plan, it's almost full coverage. That rate of the G plan is going to be about $30 more a month than the N. But with the N, what you're subject to would be excess charges. That's when a doctor adds 15% to the bill. And a lot of docs don't do that, but they could in the future. And I think that's probably likely. But the other issue is every time you see a doctor, you get a copay. And so my point is you're going to have at least the potential for more out-of-pocket expenses with that N plan. Lastly, let me say this. Your average primary care doctor is not going to charge excess, but I will tell you almost every cancer specialty hospital does. And so that extra 15% of one serious health issue would more than wipe away the additional money that you would spend on that G plan. So again, that's what I would do, but G or N would still be fine.
Okay, Anne says, can an insurance company use factors such as claims history or medical information to determine premium increases at the annual renewal for an issue-age policy?
Okay, and the answer, to that is no. They cannot do that.
Well, they can't isolate you for a premium increase. They can't, like car insurance will cancel you if you have too many wrecks. That these Medicare supplement plans don't work that way. You are in a group or a block of business, and if that whole block goes up, right, then you're going to go up. But they can't be like, Ann cost us $1 million, so we're going to jack her rates up. It doesn't work like that.
That's right. So whether it's community rated, issue age, or attained age, the only way that can go up then will be group. Now it is true with attained age policies, they will go up every year because of age, but it has nothing to do with your health. All right, so Josh is right. They cannot isolate you, so don't worry about that whatsoever. Now, I will say this, one more thing. There are times when you first apply for a supplemental plan that most companies are going to just accept you or deny you. There's some companies that will approve you, but they give you a higher premium. So that could happen. But again, that's new business. That's not switching. That's not a price increase issue.
Okay, Robert Wingate. Can a wife who is not 65 enroll in Medicare using husband's enrollment?
Okay, no. The only way that a person below 65 can start Medicare, it's actually three reasons. Number one, it's because they've been diagnosed with a disability and they're receiving Social Security disability for 24 months. So they have to be receiving those payments 24 months. On the 25th month, they will be automatically enrolled into A and B. The second way would be if someone has Lou Gehrig's disease or they've been diagnosed with end-stage renal disease, which means that permanent kidney failure on dialysis or waiting for a transplant. So that's the only way someone below 65 can get Medicare.
Okay, this one feels like a setup. Jane Dietrich says, hi, Marvin and Josh. How do I know what insurance company to go with when choosing a supplemental plan? How do I choose? What do I look out for?
Okay.
What's your best advice?
Oh, well, my best advice is to look at the history of the price.
No, the best advice is to call us. We'll walk them through it.
Oh, okay, yeah, exactly right.
Okay, give your real answer.
Okay. Now, what I would do is look at the price stability of the company. Sometimes people just want to look at the initial premium only, and that's not the most important thing. What we do when we work with folks, we're going to look back, and again, almost every carrier provides this information, but we can look back for the last 10 years and see what kind of price increases that company has taken. And I'm telling you, what really matters is the market share that they control, because the more people in your group, the larger, that's why we like national carriers instead of regional, but the larger group, the more the risk is spread out to more policyholders, the result to you is stable rates. So that's how you choose. Look at a company that has proven to be stable in the last 10 years, because more than likely, history is going to repeat itself and they will continue to be stable.
Bert, I turned 65 in November, but I will keep working. I'm happy with my current insurance. I'm going to apply for Part A in August, which would be 3 months in advance, August, September, October. Am I going to have a hard time getting parts B, D, and G when I retire?
Yeah, not at all. Now, Bert, the issue is with you. I am assuming that your employer has 20 employees or more on the payroll, okay? Because if it's 19 or less on the payroll, you have to take A and B. But as long as it's 20 or more, you're fine doing A. Now, one heads up here. As long as you don't have a health savings account, then it is fine to enroll in A only. Okay, it's fine. But if you have a health savings account, I wouldn't do A only, because then you have to stop contributing to your HSA.
I was not listening. Did you cover like SEP paperwork?
Oh,
and
that's
all that?
good. Very good.
Yeah.
I didn't answer it. Let's keep going. Sorry about that. So are you going to have a hard time? The answer is no. And the reason is because you are going to come into Medicare using what's called the special enrollment period. And it's not hard. There's a couple extra documents. And by the way, if you're our client, we do all this for you and with you. But one of the forms is called an L564, and it's the form that we use to verify that you've been working, or your spouse was working, covered by an employer-provided plan. So we have to have that. And then we have another form called the CMS 40B. And that's basically a very simple form that says, this is when I want to start my Medicare. So with those two forms in hand, or mail or fax into the local Social Security office, you will be allowed to come into Medicare during the special enrollment period. No penalties, no problems, very, very easy to do, and you can pick up a drug plan as well. Now, technically, you can pick up a drug plan 63 days after you lose your employer plan. I wouldn't do that. I would start all the same. Here's my advice, real quickly. If I'm going to lose my coverage this month, July 31st, I would have everything go into effect August the 1st. And you can do all that, and it takes 30, 60 days to get all that set up. Very, very simple process. And also, just logically, when you think about it, Medicare is glad that you're working and covered by an employer-provided plan. They're happy. They're not liable for you. That's why they make it so easy for you to come into Medicare after 65.
Okay, Kathy Heller, does your company help with Medicare problems after having chosen a plan as an ongoing assistance?
Okay, say it one more time.
Does your company help with Medicare problems after having chosen a plan? As in, do you offer ongoing assistance?
Oh, absolutely. Yeah, so Our attitude is we do not want to be a company that is like one and done. Hey, you wrote a plan, we made a commission, see you later, hope you have a great life. The structure of our company is not like that whatsoever. We have a customer service team, by the way, that's right here in this building, right in America. We're not going to transfer you to the Philippines or India or someplace. We will take care of you. And so just so you know, I want you to know, just to be transparent, when we set people up, like on drug plans, we always give them the resources and the tools to make sure they're on the right drug plan every year. Supplemental plans, most people keep them for life, but if you call in and say, hey, I'd like to shop that, we're happy to do that for you as well. So I promise you, it is not one and done.
But like, we have a complete team that every day they spend all day long helping people with, bill issues or claims issues or medications, getting things covered. I mean, they're all trained, they're all licensed. I mean, we spend a lot of money on our client support team because our goal as a company, right, is we want to do two things. We want to get you on coverage that you love for forever, and you stay our client for forever. And the only way we can do that is by offering great customer service. And the second thing is we want to get you on a plan that you love, that has great price stability, that's not going to go up, because then you're going to put a bad taste in your mouth, and then you're not going to tell all your friends about us. Yeah. So customer service, really important to us.
It is.
And all our customer service surveys and things, like when we look at companies around us, we're world-class in terms of customer satisfaction scores. And we're really proud about that and thankful for all the people we get to serve. Yeah. On retirement, this is a good question. On retirement, I plan to travel most of the time, maybe 4 times a year. Is there any coverage outside the country? Go ahead.
Oh, yes. Okay. So if I were in your situation, there's no doubt in my mind what I would do. Okay, I would definitely take a supplemental plan. Again, GN, whatever you want to do is fine. But the reason for that is because if you chose a Medicare Advantage plan and you're out of the country, the only thing that will be covered will be your emergency room visit or an urgent care situation, and that'll be probably a zero copay. But beyond that, I'm telling you, you are probably not going to get any help whatsoever from that Advantage company. I've heard it time and time again where people had a bad experience outside the country. Now, with the supplemental plan, it's not like you're going to get $1 million, but here's what 6 of the 10 supplemental plans offer. They have foreign travel emergency benefit. And by the way, we keep talking about the G plan, the N plan. Both of those have this. And what that means is if I'm outside the country and I have any kind of a health issue, I have up to $50,000 that insurance company will pay towards my health care needs outside the country. So here's the way it works. You got a $250 deductible. So let's say you got a $20,000 bill. And the first $250 is on you, and they'll take that balance, in my example, $19,750, and that insurance company will pay 80% of the bill, and you pay 20% of the bill. Now, their 80% maxes out at $50,000, but at least you have something. Now, that being said, let me tell you another thing I would do. I would get travel health insurance. I just would. It's very low cost. Get a good plan that will also give you coverage for air evacuation. True story. Had a lady in Costa Rica falls on vacation, falls out of a shower and breaks her femur and her hip. And they literally put her in a van. She travels 10 hours where they thought she could be taken care of. They couldn't take care of her. So they brought in a helicopter and airplane, moved her to San Diego. The flight was $260,000. Yeah, $260,000. Okay,
but the travel insurance covered it, right?
It did cover it. She had a $1 million air evacuation rider on that plan. By the way, folks, we don't sell those, so I'm not pushing that. I'm just telling you that's something that I would get whether I had Advantage or I had a supplemental plan.
And if you call us, we can refer you out to who we recommend.
Exactly right. So again, get a sub plan on that. You'll be happy, guarantee you.
Okay. Next question, Ann Fowler. What's the cost of becoming your client? Zero. We never charge for our services, right? Now, we don't work for free. We are insurance brokers, right? We lead with education. We try to tell people the truth, give them all their options, help them compare, and then help them enroll. And for that, like any insurance you buy, home, auto, life, whatever, there's compensation that is paid to that broker. Yeah. So we're independent. Nobody owns us. We own this, and we just want to help serve. But our our services are zero.
Yeah, and we are totally free to you, and that's what's beautiful, because the insurance company pays us, not you, and that's what Josh said. No matter what kind of insurance you buy, it is the insurance company that always pays the agent. And also, I want to add, if you were to go directly to a carrier, you went to Aetna, United Healthcare, Humana, whatever, the price that you would pay is the same whether you went to them or us. So there's no additional price for using us whatsoever, and we think there's a lot of value add when you come to us. Price is the same, and you're not just a number to us. You're a client that we're going to take care of.
Yeah. Okay. Let's see. Can my husband get Medicare from me? He does not have enough credits.
Okay. Well, here's the way that works. It depends on, number one, Janice, your age. So if someone's going to pull from a spouse that they're married to, as long as the marriage lasted 1 year or longer, and we have to prove that with a marriage license, and you are at least 62, Janice, then he can draw those benefits from you. So I'm assuming you are, you say his husband, so you are married. So married a year, you have to be at least 62. Doesn't mean you have to be taking Social Security, it just means you have to be eligible for Social Security. Now the way you do that, you can't make that application online, Janice. You actually need to call your local Social Security office and set up an appointment with them, and they'll take care of that. Again, you'll have to fax in or somehow provide proof of marriage, but it's very easy to do.
Kathy S. This is less of a question, more of a statement, but I live in a state that doesn't have excess charges, but I got G instead of N if I ever go out of state for something very serious where there might be charges, doctors, hospitals, skilled nursing. And this is like a good plan, because a lot of people think, oh, I live in a state where there's no excess and I'm good. And yes, as long as that provider's within the state, but if you have to go to like MD Anderson or Mayo Clinic or something like that out of state for coverage, in a state where excess charges are allowed, that's going to be on you. 15% of the bill with no cap. If you have a $100,000 bill, that's 15 grand right out of your pocket.
Yeah, I agree with you, Kathy. 8 states will not allow their physicians to charge excess, but the other 42 will. And so there could be a possibility that that would come up for you.
Okay. Can someone that is not Medicare eligible yet with pre-existing health issues get the Plan G when they apply for Medicare? Well, if you're not eligible for Medicare, you can't get a Plan G, right? Because supplemental plans, here's the way they work. Medicare pays their part, the supplement plan picks up the difference. So there's no way you can have a supplement Plan G without a Medicare plan.
Okay.
Or without original Medicare A and B.
That's right. And Josh, you're right. Let me just add this. So, because I think I'm a little confused by the question, but keep this in mind. Once you do go on Medicare and you're eligible, whether that's because of disability or because you're retiring or whatever, remember that once that B date starts, you are in your Medigap open enrollment period, and those insurance companies, all of them, and all the plans, all the letters, have to take your pre-existing conditions and cover you. Okay, and you have that 6-month window, which is very, very critical. So, Sandra, you really have nothing to worry as long as you don't miss that 6-month gap.
Is it good to, Robin says, is it good to shop for G plans like we shop for auto insurance? Is one company better than another or cheaper? We will live in Tennessee when we retire, currently in California. Okay. And the answer to that is absolutely yes. You should definitely compare. So you have 2 options. Number one, you can go through all your direct mail, you can read all the internet, you can watch the TV commercials, you can call a bunch of insurance companies directly, get routed all over the world, drop the call twice, and hopefully find somebody that can tell you the truth. Or you can call somebody like us, and we're not the only ones. There's a lot of great independent brokers out there, but we would be honored to help you shop those plans and really make the right decision. It is important to know that sometimes companies will come into the market and they offer these like bare bones, rock bottom teaser rates on supplemental plans, with the intent of capturing the market share, and then 2, 3, 4, 5 years later, just jumping those rates up a lot. So it's important that you don't just like look for the cheapest plan, because to switch off that, you're likely going to have to medically qualify. You want to look for a plan that has proven rate stability. If you call us, we can walk you through all those options.
Let me just add one thing about this, kind of interesting. Of course, we have tens and thousands of clients. We have one carrier that other than one case that I know of, we've never had somebody cancel their supplemental plan, ever. And so why? Because they're a very stable carrier. And so that's very important. I also want to add to you that once you live in Tennessee, your rates are definitely going to be cheaper than they would be in California.
Okay, Tom Welch, do you have expertise across all 50 states? Absolutely, yes. Licensed in all 50 states in the District of Columbia. How about Palm Springs, California? Absolutely beautiful area. Love to help. We've got lots of, I think in terms of where most of our clients find us and come from, Texas first, and then California, then Florida, which are some of the biggest, highest populated states. So very, very, very familiar with California.
We can help you there, Tom.
Let's see. Let's do this one. I'm still working and have heard you should wait until 67 before taking Social Security if you plan to continue work. Otherwise, you will need to pay back money to the government if you take Social Security prior to 67. Is that true?
Okay, yeah, let me tackle this one. So if you're 67, that means you were born in 1956. We'll just assume that's right.
Maybe she's saying she's going to wait until her full retirement age to take. Otherwise, like, money gets withheld if you make money.
Oh, okay, I got that. I'm sorry, I
Yeah.
misunderstood. Okay, then as I read the question, what I'm hearing you say is that you're probably born in 1960 or after, because anyone that's born in 1960 or after has a full retirement age of 67. Okay, so here's the way that works. It's really not about paying the government back. So when anyone takes their Social Security benefits prior to reaching their full retirement age, whatever that is, for people that are born 1958, people right now turning 65, their full retirement age is 66 and 8 months. If you're born in 1959, 66 and 10 months, and 1960 thereafter, 67. So what happens is anytime we take Social Security prior to reaching our full retirement age, there's two consequences. Number one, we're going to take a reduced benefit. It's basically about 6% a year, 0.5% a month. The second issue is, and I think this is what you're talking here, Mama Ham, and that is that if you are continuing to work, you can only make so much money. So what that means right now is from 62 to right before the year you turn for retirement age, you can only make $21,240. So if I'm above that earnings test, for every $2 above, they take $1 on my check. Now, the year I turn full retirement age, what they do is they actually raise that a lot. This year it's $56,520. For every $3 above, they take $1 out of my check. But once I reach my full retirement age, then there is no earnings test. I can make as much income as I want. So in summary, yes, it would not be wise to take Social Security if you're high income, because that money is going to be withheld from your Social Security check. So I would delay taking and let that account grow. It grows at 6% a year. And then once you hit full retirement age, if you don't take, it still grows 8% a year after that. And by the way, let me share this with you. Listen, all of our guides are trained with Social Security as well, because this conversation comes up a lot. And when we oftentimes we'll tie in an A and B application with the Social Security application for people who want to begin both of those at the same time, and we're happy to do that too for you, instead of being stuck having to call a Social Security office to work that out.
Okay, with taking a G plan, do I have to get an RX plan also? The answer to that is no, you don't have to, but you really should, for two primary reasons. Number one, for every month you go without drug coverage, you are going to be penalized, and it adds up to about $4 or $5 a year, but you'll pay that $4 or $5. Let's say you go without coverage for a year. You're going to have about a $4 monthly penalty that you will pay for the rest of your life. So those penalties accrue every single month. They get bigger and bigger and bigger. But the second reason is Medicare is going to drastically limit the time that you could come into a drug plan if you don't take it when you're first eligible. So let's say you say, hey, I'm not taking any medications. Why am I going to buy this drug plan at 65 when you enroll in your supplemental plan? And then whatever, but let's say it's April of some year, and you get diagnosed with something that needs Eliquis or something that's $500 a month. You're going to have to pay that full cost out of your pocket because you didn't have a drug plan. You have to pay that out of your pocket until the following January 1st. So yes, you're going to get penalized, but the second thing is you're not going to be able to enroll in that drug plan just whenever you want. So you could run the risk. So our recommendation is always just get a drug plan. I think there's some is even as low like $5 or under $10. Just get it. You'll have coverage, and you don't have to worry about it.
Yeah, Karen, let me just add this. I understand. Hey, I take no meds. Hope I never do. Okay, but we don't get a drug plan because we're not taking meds right now. We get it because of what could happen. And Josh gave you a great example. Eliquis right now, AFib incident. Now it's pushing $600 a month for Eliquis. You get a drug plan, you probably have to meet a deductible, but that copay is going to be about $45 a month, and so otherwise you're going to be full cost. So we don't just look at today. We got to be thinking about the future, what could happen. Let me just share this quick story. Had a guy not long ago that's on a medication, $16,000 a month. A month. That's, by the way, not the highest I've ever had. And he says this medication keeps him alive. Because he has a drug plan, his first fill is $3,000, but after that it's $800 a month. He pays 5% of the cost of that medication. You know what happened next year? He'll pay zero because that stage 4 is going away. No catastrophic at all.
Wow.
Yeah. So I'm saying get a drug plan, okay, and you'll avoid the penalties and you'll have coverage. And then you can always change those if you need more meds the next year or whatever. So they're changeable.
Okay, the next couple questions are going to be, we're going to have to be careful a little bit because we're not here to endorse particular insurance companies, and we're not here to say anything bad about particular insurance companies. Have those conversations with us one-on-one with one of the people on our team. But is United Healthcare through ARP a stable company? And the answer to that is generally yes. One of the more rate stable carriers. However, you will hear some noise where people are like, yeah, but they take 2 rate increases a year. And it's just how they structure their rate increases. They're 2 smaller ones as opposed to 1 annual. And so we'll get into arguments with people saying, hey, if they take 2, then that's a bad deal. But if you had, if every year you had 2 that each one was 2% or 1.5%, that adds up to 3 or 4%, as opposed to another carrier who takes 1 price increase of 9 or 10%. So don't get hung up on the number of rate increases because United Healthcare does it a little bit different.
Yeah. And to answer your question, Colleen, yes, I think they are stable, and it's because they have such a large market share. They really do. And on our rate, they're all going to go up. Okay, all go up. But some go up more drastically, more frequently, and United Healthcare, I think, is very stable.
Yep. Jill O says, with picking supplemental insurance, what should you base your decisions on? Presently, I am on Cobra, Anthem Blue Cross, when I turn 65, and I select that for my supplemental insurance. And the answer to that is maybe, if they offer, a supplemental plan. Not every version of Blue Cross does. Anthem, yeah, you should probably be fine with Anthem. One of the things to know about Blue Cross is they've kind of regionalized a lot of their blocks of business. So as we talk about how rate stability generally is calculated, is going to be the size of that group, right? If you have 100,000 people in a group versus 10 people in a group, and 10 people get cancer, obviously that tiny group is going to go way up in price, where it can spread out that risk across the bigger group will be a lot more stable. So one thing to be careful of with some of the more regional carriers, which Blue Cross, I think there's 27 different Blue Crosses in the country. Sometimes those can end up being a lot less rate stable. And again, not to be disparaging or anything, but that's just what we've seen.
Yeah, well, let me add a quick story to that. We write in all 50 states. This happened actually in St. Louis, Missouri. Had someone that we wrote Anthem with, and by the way, Anthem's fine. I would tell you, Jill, I would look at as an option, like any other company. But what happened is this client moved to North Carolina, and Anthem was not there. And so what happened is the way they handled the future price increases was they were able to increase that client's rate to the highest rate they had available in their home state. And those are terrible terms, by the way. So I just was not real happy with the way Anthem really took care of that case.
Okay, need a clarification. Ron Rogers says, client has a husband, 55-year-old, had brain issues. I'm guessing Ron must be an agent. Client has a husband, 55 years old, has brain issues, is applying for Social Security disability as we speak. Once he gets Social Security disability, am I correct saying that he can't get Medicare, Medicaid for 2 years? Don't know about Medicaid, but Medicare for sure is going to be the first day of the 25th month after you've been receiving Social Security disability insurance payments. You then become eligible for Medicare, so they are going to need to wait 2 years.
Yeah, and it takes an average about 6 months before that case to get approved. So they'll backdate that from when you first applied. But Josh is right, 24 full months. And by the way, Medicaid is state, and federal, but. Those he could be eligible for Medicaid for sure, based upon income and assets. And if you're an advisor, you would probably understand that. But Medicare is only that 25th month. Yeah.
Robin Rumsey says, can you switch Medicare agents after using one during your initial enrollment into a Medicare supplement? And the answer is as long as you want to switch companies. So let's say you signed up, because this happens a lot, was sign up, somebody with XYZ insurance company through another broker. It's been in effect for a couple of years. And they're like, wow, I really want to work with MedicareSchool.com. You guys seem to know your stuff and offer good customer service. Can I switch to you? And the answer to that is, what we would probably do is have you get on a phone call, and we will see if there is a better insurance rate in your area. And we could then do an agent of record switch, but you would need to switch plans. If your plan hasn't gone into effect, or then that's a different story. Call us. We can withdraw the old application and put in a new one. You can become our client. Let's see. Is there an additional cost to become your client? There's no increase in insurance. So anytime an insurance company wants to, let's just talk about supplemental plans. If they want to, offer a supplemental plan in that state, they have to get that price approved by the insurance commissioner. There's not a separate price for brokers or a separate price if you go direct. It is one price. There's always a commission that's tied into that policy, whether that's getting paid to somebody in, the other side of the world, or it's getting paid to us.
Yeah. So the answer is no. At all. Being our client, there's no cost at all to you. The insurance company always pays the agent.
Okay, Armand says, if you are covered by an Advantage plan and move to a state where they do not have a presence in, will it be difficult to switch to another Advantage or Supplemental plan? The answer to that is no.
That's right.
Yeah, you're going to have a special enrollment period to be able to get on a new plan in that area.
Yeah, you just want to be sure that you're making that in short order. So I'd say set it up maybe 30 days before the move, no later than 60 days after, and we can do that in advance as long as we have an address. So we're moving from one place to another. As long as we have a physical address, then we can actually take care of that enrollment. So the answer is no.
Susie Bennett, what's the difference between secondary and supplement?
I can answer it.
Okay.
Okay, if we're being technical, Susie, secondary means paying second to Medicare, which would be like a retirement plan. It could be FEHB. It could be a TRICARE for life. That would be secondary to Medicare. Supplemental plans are one of those 10 letters that have been standardized by Medicare to fill in the gaps that Medicare didn't cover. Now, again, there's a little bit of overlap in how they function, but that would be the difference. Second to Medicare versus supplemental is also paying second to Medicare, but it's filling in the gaps that Medicare did not cover. So there technically is a difference.
Okay, if you live in New York and have the in supplemental plan and move to Europe for half the year, can you keep the supplemental plan in New York if New York is your primary insurance address?
Okay, I would say yes, because you're maintaining that address. This isn't a permanent move. Doesn't sound like. Sounds like maybe 6 months here, 6 months there.
Just make sure it's 6 months and a day here.
Yeah, that's exactly right. And so, as long as you maintain a U.S. address, you should be fine with that. And it needs to be a physical address. A P.O. box is not going to work, because once you do a change of address, what happens is the Postal Service actually notifies Medicare. Medicare then notifies your supplemental plan or your drug plan to let them know of that move, and then you're going to have to take action. So just be sure it's a physical address.
Okay, Laura Murdoch, this is a good question. I turned 65 in February, I'm assuming next year, but have to sign up for my work insurance in October. What do I do? If Medicare would not start until I turn 65 and my work insurance would end December 31st.
Okay, this year, she's saying?
Yeah, she turned 65 in February. So, she just needs to enroll in the employer insurance.
Oh, yeah. And here's the simple answer to that. When you decide to retire, or you're turning 65 and you're still working and want to get off of the group plan, you have the right to do that. So don't feel like you're bound to really even any Medicare rules if you continue to work and the group is 20 or more. So you can start at 65, you can start at a later date, because that's all Medicare cares about. As long as you've been working, have active employment, active insurance of a group of 20 or more, you don't have to feel bound by these time limits.
Okay. What do you think about retirement policy as a supplement instead of a Plan G?
Well, what I would do more is compare it. So again, this would be a great example of secondary, because the supplemental plan is the G, the retirement policy is going to be secondary to Medicare. And so my question would be, what's it cost out of your pocket to have that plan? What's the drug plan? Most of them, they don't cover drugs. You got to get a separate drug plan anyway. So just look at the cost of that, and then also find out, how stable it's been in past. Hey, there were people that had wonderful coverage. We just went through this, the state of New York, and they pulled their option to have a secondary insurance and made everyone go on an Advantage plan. So what happens, with your retirement plan if they do that? So I would think that the standardized G plans are going to offer you a greater degree of stability. But again, if the retirement plan's zero, well, then I'd jump all over that. But just make a comparison of price and coverage before you decide. And we're happy to, by the way, help you make that comparison. We do it all day long.
Okay, how many months before I turn 65 should I contact you to receive coverage when I turn 65? Also, do you help with Social Security benefits as it relates to widows coverage?
Yes, we do. Okay, so what the perfect timeline is no sooner than 4 months. Because if we try to do an application online prior to 4 months of your effective date, we can't do it. So that 3 to 4 month window is ideal. If it's 30 to 60 days, it's still fine. It doesn't take that long, but the point is that's what I would do, 3 to 4 months prior. And then what we would do, as far as it sounds like you're going to decide to take your widow benefits at the same time. The way that works is this: as long as you have your own 40 quarters, we can actually do that application online for you, and then you can coordinate that with your local Social Security office to let them know that you want to take widow benefits instead of your own Social Security benefits, which, by the way, can oftentimes be very good because your own account can continue to grow up until age 70, and then your own account may exceed your widow benefit, and then you can switch from widow benefit over to your own retirement.
Okay, Megan, I was late logging in, so sorry if you already covered this. Are there any specific situations where you would recommend going directly to an Advantage plan and not consider a supplement?
Okay, yeah, there just a few. Number one, if Megan, in someone's budget, they cannot afford the premium for that supplemental plan and that drug plan, which on average is about total of maybe $140, $150 a month. I'm talking about a good G plan and a good drug plan. So if someone says, hey, I cannot afford an extra $150 a month, then don't try to, because you probably wouldn't keep your supplemental plan anyways. But if you can afford that $150, which is what, $1,800 a year, then that's what I would do. Now think about this. So even if you could get an Advantage plan at zero premium, the max out of pocket on that plan is going to be anywhere from $3,000 to $7,000 a year. So if you had any kind of a serious illness, you will spend more money on your Advantage plan in 1 year than you would spend in probably 2 or 3 years of premiums for a supplemental plan. So would I tell someone to get an Advantage plan? Yes, if they cannot afford it monthly. Also, if you are retired military, you have TRICARE for life. There's some wonderful options we have for Advantage plans specifically for TRICARE people. If you're retired from a civil service, it's called FEHB, Federal Employee Health Benefits. We have some good options for them as well. So there's a few instances where I think Advantage plans do make sense. For the general population, as long as they can afford a little extra, I would say a supplemental plan is Cadillac primary coverage versus the Advantage. And let me clarify though, here's what I think is important. The main reason I struggle with Advantage plans is because of pre-authorizations. And I have learned that people don't like the fact that their doctor does not have the final say-so. When you get an Advantage plan, the insurance company has the final say-so. So just because doc says you need a knee replacement, hip replacement, skilled nursing stay, or CAT scan or an MRI, doesn't mean you're going to get it on the Advantage. The Advantage company has the right to say, yes, we'll approve it, or no, we're not going to, or we want you to take meds for a period of time, or go to therapy for a period of time. And that's very frustrating to people that get on Advantage plans. Hey, we've had people that are in skilled nursing facilities. Advantage plan says we're not paying anymore. They have to go home early, and serious things happen. I'm talking even, I have 2 stories about people dying because of premature discharges from skilled nursing facilities, all because the Advantage plan would no longer pay. And that's sad.
Yeah. Okay, Ron, just to be clear, my understanding is that you do not have to stop working and start collecting Social Security in order to sign up for Part A, B, and D at 65. Exactly right. Medicare and Social Security, 2 different things. You can sign up for one without the other. There's no dependency in terms of when you start those.
That's exactly right. Yeah. Separate those. Good.
Sorry, if I already have Plan G, can I call you to shop other rates for the plan? We hope you do, Kathy. We'll do our best to help you.
But we're not going to tell you to switch if it's not in your best interest, I promise. We're just not going to do that. We don't.
Zachary Davis, I turned 65 this month. Would someone contact me in North Carolina for the best option for me as a military retiree with TRICARE? Okay, I'm going to give you our number, Zachary, if you're still watching. 800-864-8890. 800-864-8890. Or you can go to our website, medicareschool.com, and you can schedule an appointment right there. Okay. Let's see.
Yeah, Zachary, you have great options. You do. That's good.
Okay, the interesting question, the interesting way to look at it. Vicky says, I'm coming in late. Plan G gap coverage is 5 of 6. How many does Plan N cover?
4 of 6. For those of you who wouldn't be familiar, we're talking about gaps. Medicare has 6 gaps, and all 3 on the A side, 3 on the B side. G covers with the B deductible. Your N plan covers 4 of the 6. It does not cover the B deductible, and it does not cover excess charges when that occurs. And every time you see a doctor, go to specialist, you're subject to a $20 copay and a $50 copay if you go to the emergency room. So yes, premium is going to be about $30 lower, but I think, again, you have more risk and a little bit potentially out of pocket. Again, my same story is this. With G, you have no surprises. You can budget for it. You know what's going to be in. Potentially, you could have some surprises. Okay. And by the way, folks, if you're on an N plan and you want to go to G, now you have to medically qualify to make that move. We have people who like to do that. They just cannot get through underwriting. And I don't think they're stuck on a bad plan by any means, but I still think G is preferred.
Okay, I am 64 and have been on disability. I'm going back to work and will have medical through my employer should I drop my Medicare.
Okay. All right. Well,
maybe.
Well, yeah. My understanding, Sander, is that once you have a substantial gainful employment and you make a certain amount of money, that they're going to drop your Social Security disability. Okay. So, so she's saying, should I drop my Medicare? Here's what I think. If you have a good group plan, what I would do is I would just drop the B. You're not going to drop the A. Just drop the B. And again, that group has to be 20 or more. You want to make sure it's a good group plan, very little out of pocket for you. Then you're fine doing that, because then once you lose that group plan, meaning you retire or make a decision to come off of that, then you'll have a special enrollment period to come into Medicare.
Back into B.
And
get a supplemental
plan. So I think you're fine doing that. Just make sure that you like that group plan, the cost of coverage.
Okay, what was the comment about year 2025? Are there changes that are taking place? 2025 is when I have to join.
Yes. Okay. So what's happening in 2025 changes are the Part D plans. And I'll just keep it simple. What is happening right now, when we set up on someone with a drug plan, they have 4 stages, 4 potential different copays throughout the year. In 2024, we're only going to have 3 stages. Catastrophic stage is going away. We'll have a 0 copay in catastrophic stage. When we get in 2025, there's only 2 stages. You have a deductible, and then you have initial coverage, which is just copays. But once someone has spent $2,000 out of pocket in 2025, there's no longer any other expenses out of pocket for medications, which you all is phenomenal. Yeah. It's a really, really good change. So that's the Part D. As far as the A and the B and the G and all those plans, I don't know of any changes for 25, just the drug plans.
Pam, I arrived late, so I apologize if this has been addressed. Have you spoken about the Medicare donut hole?
Okay, not yet. And the donut hole does exist for this year and next year, and that's it. And that just simply means that when you get a prescription, Medicare is tracking the retail cost of that medication. And they take the total retail cost. So let's use Joshua's example earlier. He talked about Eliquis. Right now, Eliquis, let's say it retails for $600 a month. And every time I get a prescription filled, I'm not paying $600. I'm paying a copay, maybe a deductible, but Medicare tracks the full retail cost. So if it's $600 a month, 1 month it's $600 total. Now 2 months $1,200, 3 months $1,800. So this total retail cost is accumulating, and then Medicare takes that and they set what they call a threshold, a retail threshold. This year, that retail threshold is $4,660. So if all the meds I'm getting retail ever reaches the threshold, $4,660, then I go into the donut hole. It's stage 3, called the coverage gap. And there I have a 25% copay based upon the retail cost of medication. So if it retails for $600, I'm paying 25%. My copay would be $150 in the donut hole. Okay, so my point is we have a retail threshold. Just so you know, only about 10% of all people even reach the donut hole, but those that do reach it because they're on a lot of meds or expensive meds and they've reached the retail threshold. Now in 2024, we still are going to have the donut hole. The retail threshold, I think, is $4,700, and then you'll go in the donut hole and you'll still be out of pocket 25% there. But in 2025, that'll no longer happen. Okay, which I just shared. So hopefully that makes sense. And by the way, you can watch a video of mine. I teach this online. You can
a lot. Hey, which is a good point. So we do really 2 things around here. The first thing that we do is we have a ton of educational content that's out there. Maybe the best way to do it is go to medicareschool.com, and it says sign up for a free workshop, and you can sign up to watch a workshop. It's we have a 20-minute version, then we have a 1-hour version that you can get. And that's like a really, really, really good overview. It's all Marvin walking through the different parts of Medicare, what it costs, what it covers, your different options, laying supplemental plans at Advantage side by side, looking at drug coverage, just really everything A to Z on Medicare. So that's the first thing we do. And the second thing we do is every day, we've got a team of people that you can reach out to, and we'll help you compare and shop your options, help you enroll in Medicare A and B.
Answer your questions.
Yeah. Just make you our whole thing is like in 60 minutes or less, you should be able to go from Medicare confusion to Medicare confidence. Meaning you come in completely confused about Medicare, and within an hour, your paperwork's done, your plans are signed up for, your cards are on the way. Just try to make it easy because it really is not that complicated if you work with someone like us who's been doing it for a long time. Okay, we are at the hour mark. You keep going?
I'm good to go. We can keep going.
Okay.
As long as we need to.
My dad could answer Medicare questions for like weeks on end, so we will keep going. I turned 65 in October 2023, but plan to work for the bank and be under their medical plan. I do not need to worry about initial enrollment plan. I think she means initial enrollment period. Right. Is that correct? I do have a special enrollment period.
Exactly right. Yeah, so if you're going to keep working beyond 65, it is fine. Remember the key, 20 employees at the company or more. Have you worked for a bank? I'm sure that's the case. And you don't even have to enroll into A only either. We tell people all the time, you don't have to take A. You'll hear in the marketplace, you have to take A even if you're going to keep working, and that's not true. And you won't be penalized. As long as you have 40 quarters, 10 years worth of work, Medicare taxes paid in, there will never, ever be a penalty for Medicare A. And the only reason that matters, as I said earlier, because if you take A, you can no longer contribute to an HSA, and you may have that at the bank. So yes, you can come in, special enrollment period. And the right time to do it, just so you know, is about 90 days prior to when you're going to lose the group plan. Then start comparing and shopping. Call us. We'll help you do all that, and you can get enrolled, and it'll be a very smooth transition from the bank plan into Medicare.
Okay, Beth says my Medicare starts August 1st, which is in, 4 days? Mm-hmm. Do I have time to get on a supplemental plan before then? The answer is yes. You see our number scrolling around at the bottom of the screen. Just call us. Tell us, hey, I need to start August 1st. We'll get you over to someone who's licensed, experienced on the plans in your state. Shop all the plans, help you enroll. Now, you're probably not going to have your card until, maybe a week or so from now. But you can always call our customer service department. They can give you your policy number. Just in case something would happen in the first few days of the month of August that you would need your insurance coverage. But it absolutely could start August 1st.
And Beth, I just want to say, I'd call today. I really would. But as Josh said, you won't have a card, but you're covered. So if you had a heart attack, something happened terrible August 1st, you are covered for sure. Okay. In fact, you can even do it on Monday. As long as we submit a plan the last day of the month, we can start at the very first of the month. And we like you to have your cards in advance, so we prefer to do it soon.
Joni Jones, I am still working with the health plan over 20 employees. Do I have to sign up for Part A? The answer to that is no.
No, you don't. You do not. You absolutely do not. And it's fine. And if you don't have an HSA, it's fine to do it. But if you have an HSA, I wouldn't do it. And just so you know, here's I want to share this real quickly. Joni and others. If you're still working, you have 20 or more, if you do sign up for Medicare A, It's not a bad move, but just keep in mind that your group plan is still going to be in the first payer position. A is going to be second. And so on the A side of Medicare, which is hospital, hospice, and skilled nursing facility coverage, what happens is Medicare will not pay any deductibles and will not pay any copays. It only pays coinsurance. So there could be some coinsurance that's required by your group plan, but that's the only time they're going to pay anything for A in the second position is coinsurance. That's it.
Dennis Ashy, do all insurance companies pay the same commission for identical plans? The answer to that is no. Yeah. So now it is fairly standardized. However, there is some variance in the commission, which can lead agents, if you're talking to someone, to be biased if they're going to make more money if they sell you this plan versus less money if they sell you this plan. So my dad and I have known this obviously for like 15 years now. And so what we have done, we've built this into our company from day one, is anybody that you call in, any of our agents that you call in and help, they have zero bias in terms of what plan they present to you. They get paid the same amount. So we've really done our work because we want to take all that bias out of their suggestions and really just help you find the right plan. So if you call in, talk to us, the person you're going to be talking to, they have no bias, they don't care, pays them all the same. And I will just kind of peel back the layers a little bit. The plan that we recommend most often actually pays us as a company about 35% less compared to most of the other carriers. So not trying to say we're heroes, but just we do practice what we preach in terms of doing our very, very best to be unbiased.
Yeah, and also, Dennis, what you'll notice as you look at companies, most companies they are pushing Advantage plans because they pay a substantially higher commission and they pay a substantially longer commission. They do. And so that's why agents push them, whether that's the best coverage for you or not, and they do it because of the commission. So I'm going to show this to you. Josh and I have been doing this almost 15 years, and we will not chase commissions. We have a very successful business, but it's not because we chase commissions. What we're going to do is take care of our clients, and we have learned that commissions will take care of themselves.
Okay, this is a good question. Marissa Paul, do I pay the Advantage premium if I'm 65 but not collecting Social Security payment benefit yet? This is for an Advantage plan. And the answer to that would be yes, but here's the thing. So I'm going to pull a number out of a hat, but probably 90%, 95% of all Advantage plans that exist out there don't have a premium, right? You may, but if it does have a premium and you're not taking Social Security yet, then you can pay that usually with a direct bill. They'll send you an invoice or a coupon book, or you can have that direct debit out of a bank account. And we think for supplemental plans or Advantage plans, always do an EFT. These are not fly-by-night insurance companies. We're talking about, multi-$100 billion corporations. They are not in the business of like yanking money out of your checking account like a, fly-by-night car salesman or something. It's very, very good. We do it with 99% of our business. People choose to go through EFT. And the reason for that is, let's talk about a supplement plan real quick. If something happened, let's say you went in the hospital, let's say you went on a trip, let's say the mail didn't come, and you're set up on some sort of, I've got to write a check every single month. You go in the hospital, and then all of a sudden you find out, wait, my insurance dropped because I didn't pay the bill, right? That's just, you don't want that to happen. So that's why 99 out of 100 people that we talk to, we're setting up on EFT directly out of a bank account to make sure that your insurance never lapses.
Yeah, because 30 days of grace. If you haven't paid your premium, they're going to cancel. I want to address one more thing though, about Marissa. Marissa, just to be clear, I know you said Advantage premium. Keep this in mind. If you enroll into an Advantage plan, you're enrolled in A and B. A has zero premium. B does have a premium. So a person that's not on Social Security, they actually are going to be directly billed by Medicare for their Medicare B premiums, because I think maybe she could have been addressing that.
It could have been B.
Anyway, so and the way that works is if you're not on Social Security, the B premium can be paid direct bill quarterly, or you can set up a system called the Medicare Easy Pay, which is it's basically a bank draft through Medicare, or you can have what's called a MyMedicare.gov account, and you can go on there on a monthly basis and pay your Part B premiums, actually even with a credit card if you wanted to.
Okay, hurry up and wait. It says, retired military, 100% disabled, use VA completely for care and have for 15 years. Very happy with care. Why do I need Medicare?
Okay. All right. Retired military. Okay, now there's a difference. So I sure wish I knew if you had TRICARE for life, because there's two issues going on here. retired military tells me that you have TRICARE for life. And you don't pay a premium for that. But the problem, and by the way, I hate saying there's a problem with TRICARE, but the point is, once you're Medicare eligible and you're on TRICARE, TRICARE only pays second to Medicare. So if you still want to get the benefits of your TRICARE insurance, which, sir, or ma'am, phenomenal, I would have A and B and let TRICARE then fill in those gaps, or there's actually a special advantage plan for people on TRICARE that's very attractive as well.
Yeah.
Okay, so that's one issue. So I'm just saying to you, TRICARE will no longer pay first. It only pays second to Medicare. So you're required to be on A and B. Now, if you say to me, hey, I'm very happy just with VA, going to VA hospitals, then you can have A only. Okay, but if you want to pick up B at a later date and start using your TRICARE again, now you're going to be subject to penalties on your Part B, as well as you can only come in during the general enrollment period. So that's a pretty loaded question there. I think you got to want to talk to you more about that. I would discourage you from going without A and B, and I know there's a cost for it, but TRICARE is great insurance, but it's not going to help you if you don't enroll Medicare A and B.
Okay, and then I want to highlight, so if you're on, if you have VA benefits, TRICARE for life, or you're an FEHB, you have federal employee health benefits that are available to you, give us a call. There are plans, and I'm going to say maybe 5 years ago that came out. They're called MA only plans, and they're designed specifically for people that have VA, TRICARE, or FEHB benefits. And you can always tell what they are because they're like, the Aetna Eagle, or United Healthcare Patriot, or the Humana Honor, or something. So they always have like some sort of a military or some sort of connotation, but they're specifically designed for you. And one of the things that's great about them is they have a Part B reduction. Sometimes maybe even $100. So you get on Medicare, $100 a month. So you get on Medicare, and maybe that premium is $165 for Part B. You get this plan, and they refund $1,200 a year. So there's a lot of nuance within those, so we don't want to speak too broadly, but give us a call. We can see if that type of plan is available in your area. If it is, in a lot of scenarios, it's a no-brainer.
Yeah, and then for you, you also realize that once you did that A and B, you have a lot of options. You can do the MA only plan, use TRICARE, they'll coordinate with the MA plan, and use VA when you want to. I mean, it's the best of both worlds.
Okay, bad robot says, can you prepay Medigap insurance premiums? So you could write an annual check, and an insurance company will always take your money. Oh yeah. So I don't think you could pay anything beyond a year, though. Yeah, you can't. And surprisingly, most of the carriers don't even give you a discount. I mean, I've got clients that want to pay a whole year, and it's fine to do that, but it usually doesn't save you any money. But it's fine too. No problem at all. Okay. Pam, have you talked about the donut hole with Advantage plans? Does that exist with supplement plans? So the donut hole is something that's related to drug coverage, and he has talked about it quite extensively. That donut hole exists whether or not you take an Advantage plan that has drug coverage included or embedded in that, or you take a supplemental plan and then purchase a standalone drug plan. That donut hole, the 4 stages, the deductible, co-insurance, donut hole, and catastrophic coverage, all 4 of those stages exist whether you're on an Advantage plan or you're on a supplement plan with a standalone drug plan. And I just want to add one thing with Pam. Supplemental plans do not have drug plans. When someone has a supplemental plan, the drug plan they get is actually separate. We call those standalone drug plans. If you get an Advantage, like Josh said, it's embedded. So the structure of those are identical. No difference. Okay, Rick Zuniga, 100% disabled vet, 58 years old, hitting 25th month of Social Security. Disability is Humana Honor. Remember, I just mentioned that a minute ago. Right. A good choice to benefit from the monthly Part B give back. Mm-hmm. It could be, I would say, just compare all the other different MA-only plans. If you call us, we can help you do that. But we recommend the Humana Honor plan all the time. So, let's see. What can I do about my supplement insurance going up $50 a month each year? So that's a lot. That's a whole lot. So that means maybe one of 2 things. You went with a smaller regional carrier with a very small book of business, or you might have gone with one of these companies that didn't have any premium stability. They came out with a low teaser rate, and all of a sudden now they're jacking their rates up. Here's what you should do. Give us a call. We will ask you some health questions. Well, first, you might live in a state that you don't have to answer health questions, but you probably do, because that's the vast majority. We'll ask you some health questions, and we'll try to find you a plan that works well for you. Yeah, I'd say, Jerry, that's a lot.
I think right now most we're seeing, $15 a month increases. So 50, that's a whole lot.
Okay.
So hopefully you can get off of it.
Okay, what percentage of those who have to go through underwriting actually pass underwriting and can therefore change plans? Kathy says.
Well, the people we work with, probably 90% go through because we're going to pre-screen you. we know what health conditions, even what medications are typically not going to be approved. So as our guides work with our clients, we're going to try to assess it fairly well before we even submit an application. But we don't make the final decision. We do what's called field underwriting, but that company is going to make that final decision. I just had this happen Monday. Had a couple that we'd submitted, I think about a week or so ago, and husband got approved, wife did not. There was a medication that the carrier did not like, and she was denied. So we're going to try to find another carrier. So again, we'll go to bat for you, do everything we can to see if we can find someone that will take you.
Jane Dietrich, Medicaid ends the end of November. I turned 65 in October. Do I start Medicare in October or stay on Medicaid until it ends? I'm working and I don't have insurance. Any Medicare penalties for delaying?
Okay, and Medicaid ends in November. I turned 65
She needs to go on
October.
Medicare.
Oh, yeah, and here, Jane, here's the situation with you. Medicaid is fine. I'm glad you qualify for that. But once you're Medicare eligible, Medicaid will no longer pay first. So you have to go on Medicare your birth month. So you're going to start your A and B in October, and if you still can you qualify for Medicaid, and by the way, a lot do not. A lot of times they have to go back through a what would you call it, requalifying. Redetermination. Yeah. There you go. And so you'll go through that process. So you have to start Medicare A and B at 65, and then see if you qualify for Medicaid. And what you may want to do then is they have what they're called special needs plans that are Medicare Advantage. That if you're dual eligible, you qualify for Medicare and Medicaid, you can get a dual eligible plan. But sometimes those are good, and sometimes not so good, and not always available.
But it sounds like she's losing Medicaid. So if that's the case, you would just probably want to get A and B in an Advantage plan.
Oh yeah,
yeah. Or you get a supplement plan, but you have to pay the premium.
I am working and don't have any insurance, right? So so number one, you're going on Medicare A and B. Then you're going to find out about your status of Medicaid, and then what you're going to do. I agree. With Josh. I would get a zero premium. Because if you're on Medicaid, that tells me maybe some income asset issues. So probably a zero premium Medicare Advantage plan would serve you very well.
Okay, we've got a lot of good questions. We do have to wrap it up, and we've got about 13 more minutes, so okay. We'll keep going through. Janet Vaughn, is FEHB with Medicare A and B considered supplemental or as good as a supplemental plan?
Okay.
That's a big question.
Okay, so for those of you that don't know what FEHB stands for, it is Federal Employee Health Benefits. And this is for someone that's retired civil service. They work for the FBI, the IRS, the Treasury Department, Homeland Security. Any of those agencies fall under FEHB. All right, and so Janet, to answer your question about the FEHB benefits, I don't know if you have GEHA or you have Blue Cross Blue Shield, but if you decide to keep them, then yes, it is going to be second to Medicare. Remember, the supplemental plans all have those letters, 10 of those options. But FEHB, GEHA, or Blue Cross, or whoever you have, would then be secondary to Medicare. So the question will be, what does it cost you to keep that? And do you have a spouse that's covered by the same plan? And so one of the cautions that we have when it comes to getting a supplemental plan, if you qualify for FEHB, you actually have to terminate your FEHB to get a true supplemental plan. So if someone gets one of those G plans or N plans, we actually have to fill out a paperwork out that's sent to OPM, and you have to come off of FEHB permanently. So we are very cautious before people do that. I've had lots of people do it, but again, we use some caution there. What a lot of FEHB people are doing today is you can either suspend FEHB and get a regular Advantage plan, or you can stay on FEHB and then get what Josh was talking about earlier, which is called an MA-only plan. And a lot of FEHB people are doing that today. So that's why Josh said that's a loaded question, because there's a lot of options. You actually have more options than anybody else when they retire. FEHB people do.
Megan says, if someone 65 plus leaves a company plan and goes on Medicare and then gets another job with good health benefits, can they pause Medicare? Is there a time limit to go on Medicare after they leave unemployment? Or leave employment, yeah.
Okay, so someone 65 leaves a company. Okay, yes, Megan, you can, but here's the issue for you. if we're working at 65 and don't go on Medicare, so and then we change jobs, just be sure that there's never a time when you are not working or not covered by an employer-provided plan. Meaning, COBRA does not qualify for credible coverage. So my point is, if we transition from job to job after 65, if you don't have employment insurance, then what you want to do temporarily is to go ahead and go on Medicare, A and B. And then if you pick up the group plan, let's say 30 days later, 60 days later, then you can always terminate the Part B, and then you will not hurt yourself in the future. You'll be able to come back into Medicare, get a supplemental plan, no problems whatsoever. So that's a pretty loaded question, but hopefully that made sense.
Okay, Marcia Green says, since April, caring for spouse through agency, 62 on Social Security. I think she went on Social Security at 62. They're going to auto-enroll her into Medicare November of this year, want to go straight Medicare and sign up for the best additional plans. When should I call you for guidance? I think the answer to that is now.
Now, yeah.
Yeah, you're within the window. I mean, we help people up to a year in advance. Yeah, I would just say now. Give us a call. The phone number is going across the bottom of the screen. Yeah. Okay.
You're just in a perfect time frame right now.
Oh, this is a good question. Dan Pissar says, I am one who will reach catastrophic this year. So in 2025, will the Part D premiums increase a lot?
Well, we don't know yet. That's been my concern. But the bottom line is, what's that?
No, the screen's getting ready to turn off. No, the TV up here. It's okay. Let's answer the question. I think we should stay on.
Okay.
I am one who will reach catastrophic this year. So in 2025, will the D premiums increase a lot?
Okay. Well, yeah, again, we don't know, but we do know that max out of pockets.
But not because I think what he's asking is, because he's going to reach catastrophic, will his Part D premium increase? Maybe.
Okay.
So Part D premiums, nothing on Medicare. If you reach catastrophic or have all sorts of health issues, that's never going to impact the price of your plan.
Okay, yeah, that's exactly right. Yeah, that premium is actually set for the whole year.
Yes.
They can't change the premium regardless of what stage you're in.
Yeah, it doesn't change. And just because you cost them $100,000 on medication costs doesn't mean they can alter your premium any more than somebody who doesn't cost them a penny.
Okay, I misunderstood the question.
Okay. You mentioned earlier that if you live in New York City, get the N plan. Then I heard you discuss the G plan. Is it better than the N plan? Without saying one's better than the other, in the state of New York, it's generally makes way more economic sense to get the plan N than the plan G. The reason being, the plan N is so much cheaper than the plan N is so much cheaper than the plan G, and in New York, you don't have excess charges, which is the primary reason you would get the G plan instead of the N.
Yeah, and all he's saying is that we think it's just a better value. But if you got the G, that's not a mistake. And if you're concerned about excess, then go ahead and do that.
I mean, if you have the budget to afford it, it's okay.
It's not a problem at all. They're both fine.
Okay. My husband retired early at 55. He has state health benefits. I am on his plan. His insurance through the state will go till age 70. So when I get 65, can I take Medicare Part A and stay on his insurance? That's going to depend on...
Well, he's retired. Okay, so here's what you have to do, Janice. You have to enroll in Medicare A and B on your 65th birth month. You have to, because that retirement plan is only going to pay a second to Medicare. Now, obviously, it could be paying first for him, unless he's on Medicare, but any kind of plan, a retiree plan, COBRA plan, all those plans only pay second to Medicare. So you have to enroll into Medicare A and B to put Medicare in the first payer position. Because if you have a big claim that goes through, I promise you when they process it, that insurance company says, no, you should have enrolled in Medicare. We're only responsible to pay second. So go on Medicare at 65.
Okay, Coolin says, so you can switch back to Medicare without underwriting. Underwriting only affects Medigap.
So you can switch back to Medicare.
So I think the question is, if you're on an Advantage plan, can you switch back to Medicare?
Uh-huh.
Yeah, and you never actually switched off of Medicare, right? So Medicare C plans or Advantage plans they're like replacement plans, but you still have to have A and B. So you never got rid of it. What happens is, when you have an Advantage plan, instead of Medicare paying for claims outright or coordinating coverage, they basically write a check every month for, I think, $800 or $900 to that Advantage plan company. And that Advantage plan says, okay, we're going to assume the risk of this person. And so it doesn't matter if they cost, $1,000 a month or zero or $10,000 that month. They're going to pay for that. They're going to pay to cover you, that private Medicare Advantage plan. So when you say, can I switch back to Medicare without underwriting, original Medicare A and B, you never really got off of it. I mean, you still had it. You would just say, I'm going to be using those benefits now, and then you would go through underwriting to get on that supplemental plan, which you may or may not pass.
Yeah, let me just add this real easily. When you think about A and B, drug plans, and advantage plans, there's no underwriting involved whatsoever at any time with those plans. Only Medigap, right?
Yep.
And that's who's switching and all that.
Okay, Scarlet Boards, and guys, we're just about wrapping this up here. Scarlet Boards, my husband has had 3 surgeries for melanoma and is on an Advantage plan. The agent never discussed a supplemental plan. And the reason for that is Advantage plans pay quite a bit better.
That's right. They made a
note.
good fat commission, but didn't take care of you all. That's what's frustrating about agents that do that, because they don't give a crud about your coverage. They care about their commission. And that's frustrating. It just is. I hate that happen. I've seen it thousands of times, literally. Okay, so if your husband...
Can my husband switch to a supplemental plan after cancer is the question.
Well, okay, so if he has been on his Advantage plan for more than a year, there's no way he can switch to a supplemental plan with a current cancer diagnosis. Here's the way it works. If he has been cancer-free and treatment-free, meaning certain medications as well, for at least 2 years, some carriers for 3 years. So as long as we're cancer-free, treatment-free for 2 to 3 years or more, then yes, you may be able to qualify for a supplemental plan. So all is not lost, but if it's active cancer within the last couple years, you're going to have to wait till we get over that period.
Okay, this is the last question that we're going to do here. Big question. How do vision plans and dental plans play into the insurance plan? So dental and vision on Medicare, I think, is the question.
Okay.
From Alan.
Okay. All right. So, so first off, when it comes to dental, Medicare doesn't cover anything for dental other than major stuff. I mean, you have, jaw cancer and there has to be reconstruction of the teeth because of that, or you're getting ready for a heart valve replacement, or kidney failure going into, for a transplant. Then they will pay for some dental work, which is, as you can tell, those are very rare. So as a general rule, extractions, fillings, crowns, root canals, all that, Medicare's not going to cover. So if you want to get some kind of a dental plan, then that's going to be a separate plan. And you can add those, frankly, at any time. The smartest time to add them is after you quit working, because then you typically don't have waiting periods. About half of our clients get dental plans, half don't. Everyone has, their concerns about that, their teeth and all that. So dental plans are not going to be part of Medicare. Now, Advantage plans will almost always include some type of a dental allowance. I don't call it a dental plan because normally you got to go to a network provider and it's only going to cover about $1,000 a year. So I don't call it a dental plan. A good dental plan is going to cover you for probably $2,500 or $3,000 a year. Advantage plans are not going to do that unless you're on Medicaid. And so that's dental. So just so you know, average dental plan right now, Josh, what, $45, $50 a month or so?
Probably 35 to 50.
Okay.
A lot of it depends on your state.
Yeah, that's right. Okay, so you're going to have a separate premium, but it's a good dental plan. I would suggest, we go with a plan that's PPO. That way, even if your dentist is not in the network, you can still, get coverage. That's that. Now, when it comes to vision, let me explain. Medicare, original Medicare A and B covers you very well with vision. Glaucoma, cataracts, wet macular degeneration, all those kind of disease of the eye are covered very well by Medicare. If you have A and B and a G plan, you'll meet a small deductible for the whole year and you're done. Okay, so you have great vision when it comes to Medicare A and B and supplemental plans. The only thing Medicare will not pay for and your supplemental plan will not pay for would be eye exams for eyewear and eyewear, unless it's after cataract surgery. So again, 99% of the things are going to be covered by Medicare, but not eyewear or eye exams for eyewear. So what an Advantage plan does, they'll come in and say, hey, we'll give you about usually $200, $250 a year credit towards eyewear and one routine eye exam a year. So that's how they kind of distinguish themselves between original Medicare. So here's what a lot of people, our clients do. They'll get a dental plan, and then normally you can add a vision plan to cover some money for eyewear and a dental plan, and those cost about $15 a month for a VSP, maybe a little cheaper if it's an iMed network. Okay? All right, so I ramble, but that's a That's a
It's an important big
yeah,
topic.
it sure is.
Okay, we're gonna wrap it up with this. We couldn't get to everyone's questions. Obviously, it seemed like people like this, so we'll probably try to do this on a monthly basis. If you need assistance, call that number at the bottom of the screen. If you have to wait on hold for a minute or two, because usually after these sorts of big premieres, there's a lot of people that call in. So you might have to wait on hold for a minute. We have 7 people out there answering the phones to schedule appointments with our Medicare agents. So we would love to assist you. It's all free. It doesn't cost you anything. Again, in 60 minutes or less, we want you to go from Medicare confusion to complete confidence.
Yeah, and if I get my way, we'll do this more than once a month. Okay, I'll be pushing for that. Thanks a lot for watching.
Yes, thanks for tuning in. We appreciate it.
All right.